is attached to the single point of entry also. We think it's cheaper to provide people long-term care through a home and community-based service situation as opposed to a nursing home, which is probably 3 times as expensive. Not that we don't need nursing homes, but we think it's cheaper. The only choice shouldn't be nursing home and nothing.
Right, right. Well, it's been interesting because in our communities, like in Harbor Springs, they've got which would have been the old county poor farms,
Sure.
which are the county medical care
Right.
facilities. And they are building attachments onto those for assisted living, which allow people to still have their mobility to a certain extent,
Yes.
which means, you know, you can walk down the little, I think it's M119 right downtown to Harbor Springs and get some coffee and those types of things.
Sure, that's very important, very, very
And then
important.
Traverse City's had a really good model with what they've been doing with the old regional psychiatric hospital.
Yes.
And so when I was on the county board, we built the medical care facility, which we now call the pavilions,
Right.
and then renovated 3 cottages adjacent to that for what they would call, it's not that you need to go into the nursing home, but it's the step before that. So there are 3 meals a day, and then there are other continuums like condos and those types of things that are right in that facility.
Yeah, you're way ahead of the curve. A continuum of care is very necessary.
Right.
And I think the smart nursing home operators are realizing that, and they're converting. They're going that way. They want to get people in there and show them what kind of services they can operate or offer for a longer period of time.
Now, Sault Ste. Marie's taking a little bit different model from what the mayor's briefed me and some of the city leadership, is that their hospital is still within about 2 blocks of downtown.
Yes.
And they're trying to build more independent and more condo apartments so that those are adjacent to the hospital. Are you aware of any other communities that have tried that?
In California, they are. I happen to know that personally because my mother-in-law is in a facility like that.
What other sorts of things should people be looking at, you know, with the aging of the population? What other things should we be thinking about in northern Michigan?
I think transportation is a key issue. Obviously, you've got some lovely, important cities there, but you also have vast rural areas. And the question is, how do people who want to live in their own homes get to where they need to go?
Correct.
And the answer usually is some form of public transportation.
Right.
And the question is, how do we put that together? AARP in Michigan has launched a series of efforts in some areas to get involved, to get our members and volunteers involved in helping those transportation programs get off the ground. And we really haven't done much yet in the rural areas, and we think it's extremely important.
Right. So you're saying, like in other states, what they've done is that they've contracted for additional services with
in some cases, yes.
What are some of the, has this been mostly what, faith-based, or has this been public transit, or?
There have been offshoots of public transit that have been attached to public transit. There are faith-based organizations that have done it, several successful models along those lines, which we encourage, obviously.
Right. Okay, so we've got the transportation issues, and then I wanted to go back to this 211 program. How does that work? And I apologize, I'm not familiar. Is that different than the single point of entry, or how does it? It
is, because the 211 has access to a lot more different kinds of information. It's not just healthcare. I didn't mean to steer you in that direction. They're operating in Michigan, right now in Lower Michigan and in the Upper Peninsula. They're covered pretty much maybe 70% of the population, but in your area and other areas they're not so strong.
Okay.
And they're trying to get off the ground. And the United Ways are operating these and putting them together. And my understanding is that they have a very sophisticated phone bank where you can access to information that you might need. Not emergency information. You're obviously told to call 911 for that.
Right. So that gives them a resource pool and some.
Yes. I'll give you an example. The SPE in the Upper Peninsula is operated by an organization called UpCap. Well, they operate the 211.
Just slow down. The SPE means single point of entry.
Right,
so and so they, besides doing the single point of entry, then they operate the 211.
Right.
And so in many communities, then that would be available to any kind of a person that wants.
Sure.
Okay.
And a single point of entry, by the way, isn't just for people who need Medicaid services. It's for private pay patients or persons also. I mean, just because you have a lot of money doesn't
Right.
mean you're not going to have any questions about what to do
Right.
with your aging parents.
Okay, let's talk a little bit about elderly abuse. We talked about sort of, the restructuring and some of the issues about life. How are predators going after seniors?
I have lists.
Yeah.
I could read you a list of things that have. I'd say the number one thing is identity theft in all its forms, credit card fraud, door-to-door sales folk who are not really charitable donations. Elderly folks tend to be more charitable than others, and their charitable donations turn out to be fraudulent.
Right.
Medicare drug discount card fraud. Almost as soon as the federal government created the Part D Medicare prescription drug program, you had fraud creep up because people were they go where the money is. Let's put it that way. Payday loans that don't pay. There's all kinds of scams, but the big ones, as far as we're concerned, are abusive lenders, credit card fraud, ID theft kinds of things.
Well, let's go through sort of some of the things that you suggest dealing with on credit card fraud. Now, when we've taken testimony in other committees I've sat on, it was very clear that we shred everything at the Allen household.
Very wise.
I'm still amazed that other people don't recognize is that all those applications that come in the mail are probably one of the most simplest ways to get your ID and
computer phishing is another way. Someone purporting to be an official agency, perhaps the IRS, asks for you to confirm your Social Security number, and then you email that back, and all of a sudden your accounts get looted.
Right.
Yes. Right. AARP has, I would guess, maybe 50 or so various brochures and ways to protect yourself. In Michigan, if I can put in a plug here, our expert on computer fraud or consumer fraud is Anita Salustro, and she's at area code 517-267-8913. And she basically has a group of volunteers who go around the state educating folks about how to avoid fraudulent fraud and avoid scams, essentially.
Wow. I mean, because you start talking about some of the things that can happen, and I know that that the people I've talked to that are more mature, that is true. But the internet is an amazing access point.
Right, it is.
We have individuals I know that email pictures back and forth with their grandkids and have all that. But it's very easy to see how those scams run. We had at our household. Someone, we're not sure how, got one of our credit card numbers, and several Xboxes were shipped to India on our Visa card, and my wife does a great job, but that's usually, to me, one of the things that they've talked about is that start monitoring your credit cards on a regular basis.
Yes, definitely.
Don't just pay the bill. Make sure you go through and line item to make sure that we actually spent. Because they do a few things first just to see if you're monitoring it, and then they go hog wild.
Right, exactly. You're so right. In my household, my wife ensures that every magazine gets thrown out with the address torn off.
Right.
Any bill that we might throw out, it's shredded.
Right.
Everything is shredded. It's almost it's really too bad we have to live like that, but it's absolutely necessary. And as I said, especially as it turns out, seniors tend to be more trusting in them because they had never had to deal with this before.
Now, going to the issue you're dealing with on the website, in the web issues, you talked about the brochures. Are there a specific website for AARP that might have, do they go to aarp.com or org or gov?
It's www.aarp.org. And there's a section called MoneyWise and then consumer scams.
Okay.
And there's ways of getting advice on how to protect yourself against that sort of thing.
Let's talk about healthcare issues, and you brought up some of the issues on Medicaid Part D and some of the programs, and I know we've gone through the first phase of the implementation of the Bush administration about 18 months ago.
Right.
Now we have these great mature citizens coming on board, and so it's going to be a continual education process from what I've been briefed.
Yes.